Welcome to rePROs Fight Back, a podcast on all things related to sexual and reproductive health rights and justice. Hey rePROs, how's everybody doing? I'm your host, Jenny Wetter, and my pronouns are she, her. So y'all, I think I told you my birthday was earlier this month. I forgot to mention on a very exciting note, I got an extra special present on my birthday. My 2 Anthem Awards came, and it was so exciting to actually hold the trophies in my hand. And we'll probably share a picture. I'll make sure that Elena posts one on social so you can see them. They're beautiful. It was like this extra special gift on my birthday, and it really made me happy. What amazing timing. Just so much fun. Let's see what else is exciting. I feel like I've just been a little blah lately, and I'm ready for spring and to be out, and I think I need to get back to going out on walks during the day more. I feel like I've just been really busy with work and so focused on getting this report out that we have coming out next week and all of these things that I've just been focused and buttoned down and just working on the things instead of taking 20 minutes to go walk around the neighborhood. And I think it's starting to get to me a little bit. So I need to be better about that. So let's just say that's something that I am working on. And my inner Statler and Waldorf have been particularly loud lately. So I just need to be better about the self-care right now. So I'm going to work on that. Yeah, going to work on it. I think those are the big things happening right now. I think we'll just maybe go to this week's interview because I'm really excited about it. Because we are not just talking about all of the things that are going wrong, because there are a lot, but there are also people who are doing really great things and state legislators who are trying to introduce good new policies. And I am so excited to have the wonderful Jennifer Driver with the State Innovation Exchange on to talk to us all about the good things that she is seeing at the state level. And y'all, it was just what I needed, was to have this dash of hope and have a really almost 99% just positive conversation about the good things we are seeing in the space. And it made my day. So I hope listening to this hopeful conversation makes yours as well. So with that, let's go to my interview with Jennifer. Hi, Jennifer. Thank you so much for being here today.
Hi, thanks for having me.
I'm so excited to have you. It has been a very long time since I've seen you, so this makes it extra exciting.
Yes.
But before we get started, would you like to take a minute and introduce yourself and include your pronouns?
Sure. Hi, everyone. I'm Jennifer Driver, she, her pronouns. I'm the Senior Director of Reproductive Rights with the State Innovation Exchange.
Like I said, I'm really excited you're here. And I feel like talking about repro, I feel like you so often doom and gloom. And I'm so excited to talk to you because we're going to talk about great things that are happening at the state level, which I think people too often think of all of the terrible things that are happening. And that's not to say they're not, but I'm really excited to let's talk about the hopeful things. And so maybe let's just kind of do a big picture. What are you seeing at the state level right now?
I actually really love this framing because I think you're right. It's often that we only focus on the gloom and doom. And as we think about what we need to rebuild following the Dobbs decision, we need to be thinking about where there are elements of progress, where there's joy, and how we can find things that are really inspiring. And so even though nationally, and we're coming up on an election in November, that there will be 85 state legislative chambers that will be up for election, there's still a lot of opportunity. One way opportunity is to see, how do we keep those legislators in office that are really bold and visionary and can not only play defense, but how do we get on the offense and move things forward? And so, while yes, there are some really bad things that are happening in states, the beauty of state legislatures is that things move really quickly, right? So just as hard and fast as the bad bills that move, those really proactive pieces of legislature legislation can move really quickly as well, whereas it's very different at the federal level, right? You know this. Everything is stalled. It moves really, really slow. But the beauty of the state houses is that things can move really quickly. And so we have the great opportunity to push forward some really proactive and visionary things as we rebuild to what this world that we want to see.
I really love like not focusing on like just the defense and like trying to prevent the bad things from happening, but to like dream bigger and like do proactive things. So what are you excited about right now that you're seeing?
Yeah, I mean, so there are things around a couple of different buckets, right? There's a lot that's happening around contraceptive access, which I'll go into in a second. There's some things that are happening around removing funding for crisis pregnancy centers. That is really exciting to see. There are some constitutional protections that we're seeing. So maybe I'll start a little bit with the contraception because it's kind of at the forefront of a lot of folks' mind. We've had the announcement of O-pill, the contraceptive pill that's going to be over the counter. And so let's start there.
Yeah.
Okay. So in Idaho, we've got Senator Melissa Wintrow has looking to expand health benefit plans and student health benefit plans to cover prescription contraception, that it must provide reimbursements for 6 months supply, except under certain circumstances. But the idea is that there is this expanded access for contraception coming in Idaho. And like why that's so important is because often we're not thinking of really proactive things that are coming out of Idaho, right? Sometimes you're like, oh, these red states, there's not a lot of really great things happening in these states. And yes, even in these kind of ruby red states, there is some beauty and some really positive things that are happening in those states. You're also seeing a lot of bills related to contraception that requires like community colleges to develop and implement plans to provide students with access to over-the-counter contraception. That's a big win that's happening out of Maryland. We're seeing, bills that would allow for reproductive health care, including to incarcerated individuals. And that's happening in Massachusetts. There's some constitutional protections that are happening. A bill in Tennessee, there's something in like South Dakota and Arizona. And while some of these bills, right? So I know listeners are going to be like, okay, but they were introduced, but are they going to be moved? It doesn't actually matter. Like, yes, we want movement to happen, but the very nature of these legislators in these states that are introducing these legislation, having conversations about it, that it's happening is a positive thing, right? I think, we kind of rest on thinking, okay, what are the bills that we can actually win or that will pass? And for me, I also want to see what gets introduced in state houses.
I think it's so important to talk about the like glimmers of light you're seeing in red states. And as we're having this conversation and when this episode comes out, we're getting ready to launch our annual 50 state report card. And, while there are glimmers of light in red states, there are also places where there are blue states that have like big gaps of like things that need to be filled. And like, so I've been doing the report card for, I think this is going to be our 11th or 12th one. And like every year I do it, I'm always shocked at like some of the like blue states that like, going back to your old life, don't mandate any form of sex education.
Across the country, we're continuing to fail our young people, whether it's around sex education, the information that they're able to receive, the access to care, how that they can actually control their own bodily autonomy without having someone else control it for them. And so you're right. In blue states where they are moving on so many expansive policies, the policies that they continue to fail on is the policies around young people. And that needs to change.
It's on my mind just as because we're doing the report card. And oh man, it's so frustrating to see some of the states where that's the case.
You know what? It's really disappointing because I think in a lot of states where you can put forth bold policies, the thing that they are always willing to carve out are young people, right? They'll say, oh, we want to pass this piece of legislation. We want to get it over the finish line, but actually it will be easier if we remove access for young people. And they are willing to make that concession. And what's really disappointed is often it's not the antis that are, saying, hey, we need to make this carve out. It is our side that is so unwilling to take risks that will allow for us to be really bold and include everyone as part of the conversation, including young people.
Okay. So we talked about expanding contraceptive access. What's the next bucket you want to talk about?
Yeah. So the other one that I probably want to highlight. So Illinois has a really interesting bill. It's by Representative Kelly Cassidy. So this bill seeks to provide people who are unfortunately forced to relocate to Illinois as a result of attacks of healthcare, whether it be around abortion access or gender affirming care, that if they were to move to Illinois, that they would be able to get this $500 tax credit. Now, again, I know people are going to say $500 isn't a lot. It is a start, right? It is a different way of thinking about how do you get assistance to people who are going to be relocating into the state. The bill also provides the same credits for licensed healthcare providers or teachers and their households coming to the state. And so, I think in this time of kind of grappling with how do other states respond to the people who will be coming into their states, what's really being creative is them thinking about what are the resources and needs for the people coming to their states. So I can give another example. Kelly Cassidy, the representative from Illinois, once Dobbs was coming, she said, it wasn't enough for me to figure out what do I need to improve the lives and the conditions for people in my state. I know that more people will be coming to Illinois. So how do I make it easier for them when they get here? And so she's been doing a lot of thought about how does she assist people who will be relocating into Illinois based on them having to leave their own state. Now, is that enough? That's the one thing I want to say. Is that enough? No, people should not have to leave their state to come to another state to get care. And this is one thing that's a legislator is thinking about as more people come to Illinois.
I have really enjoyed seeing how Illinois has been trying to think through ways to make sure that they are expanding access. For the last couple of years, I grew up on the Wisconsin-Illinois border. So very close to the heart, a couple 100 yards from Illinois. So always keep an eye on it. And so it has been nice to see that even as Wisconsin was kind of failing people around reproductive health care.
Yeah, I think we have this convening that we just recently held that talks about beyond borders and what the U.S. can learn from other countries. And what's really interesting is that one of the legislators said during our conversation was, I want to look beyond borders of states as well, right? So how can I learn from other states? What are they doing that's really innovative that I need to be implementing? How can I tweak that so that it will work for my state? But how do I look beyond just my individual state to recognize that everyone needs care? And how do we talk across to other legislators to ensure that we're able to get care to the most number of people? At 6, we hold these rapid response rooms every week with state legislators. And it's a really great opportunity for them to be talking to one another, strategizing, thinking through, okay, what are you doing in your state? What could possibly run in my state? What are the bill amendments that I should be thinking about? And so, when people are thinking, oh, not a lot is happening, there's so much happening, right? And there's a lot happening behind the scenes. And that actually gives me a lot of joy. It gives me some optimism as we go and move forward, just to know that there's so much happening.
Yeah, that's one of the things I really love that y'all do is setting up that space in that community for pro-abortion and repro broader legislators to talk together, to have that sense of community and support. I think that's so important, especially if they are in unfriendly states where they may not feel that support in their state, but knowing that there is a big community trying to push these things and, connecting with other people who are maybe in unsupported states. I just see that as such a huge, huge thing.
I think it's nice also because, in these spaces, they can ask whatever question, right? That there is I'm not showing up as someone that's holding you accountable in your state. While I do want you to be held accountable, right? Like the decisions you make are really important, but it is a space where you can just be really authentic, ask the questions that you need to ask, and figure out what is going to be best for the folks in your state. And I think that is really important. I also think, Jenny, if I'm being really honest, it's really important for legislators of color. What I am concerned about, while we're talking about a lot of optimism right now, the thing that I am really concerned about is the women of color, particularly Black women in state houses right now, who are just hit with a barrage of just everything, right? Just everything coming at them. And the number of them that are saying, you know what, I just can't do this anymore. And that's really harmful because the way that they have shown up really with that reproductive or that justice framing that we're really fighting for is critical. And, they're not endorsed at the same rate as their white counterparts. They don't get the same funding to run for office. And yet they are coming to the state houses with this intersectional approach that we're often wanting more legislators to come with. And so, when I think about what are the ways that we need to continue to support legislators and work with legislators, it is thinking about legislators as a person, but themselves in totality of what they're actually facing in the state houses.
That is so important. Like, I think it's one of those things that gets, I don't know if left out a lot is quite right, but in certain circles, right? Like there's just like a really big push on like wanting to see more women in elected office, but like then they forget the other pieces of like, I want to make sure that we're seeing LGBTQ people and like people of color and Black women and like bringing all of the experiences, because once we have a more representative looking group of legislators, like we will get better policy.
And it's so true because legislatures right now are getting older, they're more white, and they're more male. And so the lived experiences, the policies that we want to see put forth are not happening, right? Because the people who are closer aren't the ones that are actually in the center making these, passing these legislations or these bills, right? The other part that I think gets left out of the conversation is most state houses are either underpaid or not paid at all. They are part-time legislators with no staff. So often we think about congressional leaders that have staff, they have money, they have resources. That's not the reality of state legislators. And so the expectation just looks a lot differently because they are part-time, right? They are underpaid. They are working multiple jobs and still showing up day in and day out to put forth some really, progressive pieces of legislation.
Yeah, it was just making me think of like the barrier of entry being so much higher for that diverse crowd. Again, it's so many things need to be fixed all at once in order to, like, you think of like one simple fix, but it's like all of these layers of things that need to be improved in order to get to that vision.
That's true. Okay. So, but again, maybe coming a little bit back to some of the exciting things on that, I want to just name one other additional one that I have not named.
Yes.
Is around funding, right? So we have talked for years about anti-abortion centers, crisis pregnancy centers, the ways that they are, they lie and are deceitful and all of the harm and bad things that they do. And there are legislators that are actively working to fight against this, right? So in Pennsylvania, there is a bill that would allocate $10 million to family planning providers and prohibit funding for anti-abortion centers. So we're seeing more and more pieces of legislation that are trying to defund and prohibit state funding for anti-abortion centers. In New York, to your point about kind of these blue states that still there's so much more that needs to be done. There's a bill around providing state funding to providers and abortion funds and establishing an abortion fund that allows taxpayers to make gifts to. I think that's really important because on the flip side, there was a state that had put this bill forward that was going to allow tax credits for people who were contributing to anti-abortion centers, which is so harmful, right? Because it's not only harmful, it is deceptive in that people are thinking I am contributing funding to these centers, thinking that they are actually helping people, not knowing the reality of what these centers actually do. So here, what we have on the flip side in New York is actually providing tax credits for abortion funds. And that I think is a really interesting and something new that I'm seeing this year.
I really love to see that. Again, one of those other things that's like seeing more familiar with because it's on the report card. It's like we give states things beyond that are measured in the report cards. Like they get like an A through F score for things we measure, but then they make it a plus or minus for things that are like good or bad that aren't like included in the report card. And one of those minuses is those Choose Life plates that fund crisis pregnancy centers.
That's right. That's right. The last thing that I think I want to just really make sure I highlight is kind of the narrative shift that I'm seeing that's happening in states. So we bring on state legislative fellows every year. And one of the fellows who came on was Senator Natalie Murdoch out of North Carolina last year. And one of the things that we were really trying to get a sense of was around self-managed abortion in states. And what did state legislators know? And what she did was she did these in-depth interviews with state legislators about their knowledge, their attitudes, and belief around self-managed abortion. And that gave us a sense of how to work differently with legislators. But it was from those conversations that a legislator was like, oh, I want to make sure that people in my state have access to self-manage, like that can self-manage their abortion without being criminalized. And so she went back and introduced a bill to ensure that people who self-manage their abortion weren't going to be criminalized. There's still a long way to go. Like there's more that needs to happen with legislators, but it was still a really great way to help think about how do we change the knowledge, the attitudes and behaviors around state legislators on this issue, but also where do we need them not to be barriers and cause more harm for people who need abortion care in their state.
Yeah, that's definitely one of those things that's like so important right now in the world we're in is to like, yes, have the visionary things, but also having the harm reduction things, the things that like maybe aren't expanding access, but are like preventing further harm. And like when you can talk about like criminalization, like that is like a huge harm that we need to really think about ways that we can stop it.
I mean, I think often that we talk to legislators, like, here's the thing we need you not to do. We don't need you to legislate medicine, right? You're not doctors. You're legislators. This is where we need you to be. But where also we need you to do is remove the barriers so that providers can actually provide the care to their patients. And as long as we can get legislators to see that part, that's how we're going to be working with them. And I think that's a really critical piece. And more will be coming, as we do more work with them on that.
Okay, so that's what you're seeing now. Do you have any I know you totally have a magic crystal ball and can see the future, but like where do you think you see some of the proactive legislation going in the next year?
I wish that, this conversation has been so optimistic, right? And in my head right now are all of the bad things that I know are coming, right? That's the thing that I'm really struggling about, right? I was having a conversation yesterday with some legislators about our nervousness around personhood, right? And so there's so much. This is the part where I want to talk about all of the really good things. And I'm like, oh, here are some bad things that I know are coming. Okay, so I'm going to put the bad things aside for 1 second. I think that there are some really great things that are happening around maternal health, right? Particularly Black maternal health in states and in southern states particularly. So I'm excited to see what legislators are and how they're moving around maternal health, midwifery, and doula bills, right? I think that those
awesome.
That's something really great. I am also, as more and more calls to defund anti-abortion centers, you're seeing more and more states put forth bills to ensure that state funding does not go to anti-abortion centers. I think we are seeing a lot of legislators learn from the failures of our movement to think about how they can fight back against a lot of these gender affirming, like these anti-trans bills, right? And so they are like a lot of the folks who were lead sponsors for a lot of the LGBTQ bills in states have been coming and talking to some of the lead sponsors of like the repro bills to say, what's the like, how can we strategize and think? And so we're seeing more and more cross movement kind of conversations that are happening in the legislative spaces that I think is really important.
It's so important because it's the same playbook. And like, we need to make sure we are talking together because it's going to have very similar, if not the same solutions. And like the whole goal of some of this is to like peel off support between the two.
That's right.
And so we can't let that happen.
It's to peel off the support, and it's to seriously to say, okay, this is the issue that we're going to focus on right now. We're not going to worry about that one over here, all while they're able to chip away at LGBTQ rights on this side because we're so busy focused on all of the bad things on the other side that are the other issues that are happening. And so, it is part of the playbook. And so the more that we can get legislators to talk and realize this, and it's not saying that they didn't, but I remember when I first started kind of really working with legislators and saying, hey, I'd love for you to, be more involved on some of these repo bills. And they said, I will vote for them, but that's really not my issue. And you can't say that anymore, right? Like, we really need you. All things are going to be your issue because these things are really interconnected. And so we're seeing more and more legislators really taking charge on being vocal on all of these attacks and not really the attack that they, the issue that they came into the State House for.
Okay. So I always love to wrap up, and I know you're going to have lots of great ideas on this, of how can people get involved? So like, how can our audience get engaged on these issues?
So the one thing that I always say, the first thing I always say is find out who your state legislator is, right? If you are in a state, not like me, where I'm in DC, and you have a state legislator, right? Find out who your state legislator is. If you're in DC, learn about the council, right? Learn what they're putting forth, get to know them, do outreach to them. The other thing that we are seeing is there are often times that we don't have enough folks testifying for these really key bills, right? Whether you're a provider in states, there are states that have a wealth of providers, right? New York always has a provider. California has providers that they always go to. But there are times where I'm like in Idaho, right? In Kansas, in these other states, that if you are in those states, we often need people to testify in state houses. And it just doesn't happen. Like sometimes we will have a much smaller number where the antis have flooded into the state house and they're there for hours and they're able to spew their hate all day long. And so if you're able to and willing, we would love to see and connect you with some of the legislators, have you testify, get connected, because they really do need to hear. The other thing that I would really say is applauding legislators when they do really good things, right? They hear all of the time, all of the bad, when they do something bad, they hear about it. When they do something good, they don't really always hear about it. And it is really, really important that you are saying, thank you so much for doing this, even if you're not in that state, right? So there are often times that I will see something that will happen in Nebraska. I don't live in Nebraska, but I will reach out to them. Thank you so much for doing this because this is really important. And here's what it means for people in Nebraska, but not only for people in Nebraska. Here's what it means for everyone else. And so doing the outreach and really telling them thank you is something that I can't stress enough.
Yeah, those thank yous are so important. I mean, legislators are people, right? So like they really like to know that they are doing good and hearing that support, because they're probably hearing from all of the people who are unhappy that they took that action, right? So like hearing from those that are happy is really important.
And it could be the day that they're like, this was a really tough day in the state house. And your thank you could be the thing that's just like a re-energizing thing for them. They're like, yes, I am doing something really good. I am meaning, we're human, right? even like ourselves, when we have really tough days and we're like, oh, I don't know how I'm doing this right. And you just get that one email of praise and you're like, okay, I can do this. It's the same thing for legislators. They really do need that.
Jennifer, thank you so much for coming on. It was a joy to talk to you.
I love coming on. I always love talking to you.
And we had to talk about happy things. Like, what more could I ask for?
I mean, in this moment, we have to remember all of the really good things. There are things that are going to sustain us. It is not the anger and the hate that is being spewed. It is those things that are really going to inspire us, right? That are going to fuel us to continue to build. And that's what we need to kind of rely and can remember as we move forward.
Okay, y'all. Like I said, I really had a wonderful time talking to Jennifer. It was really just like that dash of hope I needed. And I'm going to take that into my weekend because I'm recording this on Thursday. So I'm going to take it into my weekend and just like savor the hope. And with that, I will see all of you in next week. If you have any questions, comments, or topics you would like us to cover, always feel free to shoot me an email. You can reach me at Jennie, JENNIE, at reprosfightback.com, or you can find us on social media. We're at rePROs Fight Back on Facebook and Twitter, or rePROs FB on Instagram. If you love our podcast and want to make sure more people find it, take the time to rate and review us on your favorite podcast platform. Or if you want to make sure to support the podcast, you can also donate on our website at reprosfightback.com. Thanks all.